Hello, my name is Melodye May, and I am a social service administrator at the Delaware Division for the Visually Impaired. I've worked with the division for over 23 years, and I spent 15 years providing direct services to agency consumers as an assistive technology trainer. Currently, I'm the program manager for the Independent Living Services Program. It is my pleasure to speak with you today regarding culturally competent service delivery. Before we get started, I wanted to describe my picture on the screen. It is a picture of myself, a headshot. I am an African-American woman, and I have blonde hair, and I have on a black top, and I am smiling, and I have red lipstick on. So the goals of today's webinar that I would like to share with you include defining cultural competency, exploring the impact of cultural, ethnic customs, and beliefs on the provider-client relationship, identify the benefits of cultural competence, outline the stages of developing a culturally competent organization, and to detail what data to collect. So first, we must consider, what is cultural competence? Cultural competence can be defined in healthcare as the ability to provide care to patients with diverse values, beliefs, and behaviors, including tailoring healthcare delivery to meet patients' social, cultural, and linguistic needs. So if we want to take that a step further, we can ponder what is cultural. And culture can be defined as integrated patterns of human behavior that include the language, the thoughts, communications, actions, customs, beliefs, values, and institutions of radical, ethnic, religious, or social groups. So all of that together comes into play to compose what culture means to an individual. So in consideration of the culture, customs, and beliefs of an individual, definitely that can have an impact on how consumers understand health concepts, how they take care of their health, and how they make decisions related to their health. In a lot of the discussion today, I'm going to be referring to healthcare systems. So even though an example of Division for the Visually Impaired, our service providers are non-medical. However, the care that they provide, they work in conjunction with healthcare providers. So the information is relevant for both entities. So here are some examples of how those culture and ethnic customs can influence how your consumers interact with you. So number one, we're going to talk about health beliefs. So in some cultures, people believe that talking about a possible poor health outcome will cause that outcome to occur. I've definitely come in contact with this line of thinking in the provision of speaking things into existence per se, where people think if you claim a certain condition, that would come into fruition. So sometimes that definitely influences how consumers understand health concepts and how they view that a poor health outcome will cause that outcome to occur. Health customs. In some cultures, family members play a large role in healthcare decision-making. I can recall back to some consumers that I've served before, and although we would like to always speak to the patient, especially when we consider patient-centered approach to care, some families would rather speak for their loved ones. And in some instances, the entire family may come together in the decision-making process in terms of deciding what is best for the consumer in terms of service delivery provision. So that as well definitely has an outcome. As we consider ethnic customs, differing roles of women and men in society may determine who makes the decisions about accepting and following through with medical treatments. Religious beliefs and faith and spiritual beliefs also may affect healthcare seeking behavior and people's willingness to accept specific treatments or behavioral changes. And even interpersonal customs. Some people believe eye contact or physical touch that some may think would be establishing a rapport with an individual. They may find that inappropriate and quite honestly offensive. So consider those cultural customs and beliefs during the service provision process. Take time to learn about your consumer's culture. And what I mean when I say that, please don't be afraid to respectfully ask patients about their health beliefs and their customs. And in most instances, they will be more than willing to share that with you. Take note of their responses and document that for future records. So as you continue to provide services and other interagency programs may engage with that individual, their preferences will be noted. Definitely address patients' cultural values specifically in the context of their healthcare. For example, you may ask a consumer, is there anything I should know about your culture, your beliefs, or religious practices that will help me take better care of you? Or you may ask, is there anyone else you would like me to talk to about your condition? There are a lot of consumers that entrust their healthcare information to their loved ones, such as a spouse or a daughter or son, or even a trusted friend. Definitely be careful to avoid stereotypes. Although we say that different cultures, generally speaking, ascribe to certain beliefs, that doesn't always follow suit. So understand when you're caring for someone that each person is an individual and they may or may not adhere to certain cultural beliefs or practices that are common in his or her culture. So it's very important to ask the questions up front to avoid any misunderstandings later on in service delivery. Learn from other resources. There's plenty of information on the web about different cultural information. Ensure that your service providers engage in training, and we will detail more about that during this webinar. And also rely on community liaisons and organizations for information regarding engaging consumers in the service delivery process. And last but not least, definitely use professional interpreters. This is very important because some individuals will bring family members to interpret for them. However, with a professional interpreter, you can rest assured that it will definitely help avoid misunderstandings due to cultural differences. When we consider the benefits of culturally competent service delivery, there certainly are many. We'll start with social benefits. So your aim should always be to increase mutual respect and understanding between patient and organization. So you are the representative, one of the first representatives, maybe outside of intake, that this individual will come in contact with. And you want to make sure that those first experiences are positive ones as you seek to establish a rapport with your consumer. And that certainly will help in the process of increasing the trust relationship that you may have with your consumer. Definitely promote the inclusion of all community members during service delivery. So if someone would be comfortable having a representative from their community to help them to understand and interpret the delivery that you are providing for them, by all means encourage that. Culturally competent social benefits also increases community participation and involvement at health issues. We have had different events at various cultural celebrations, at certain libraries, in target areas where diverse community members reside. So that is important to remember, that to target those different cultures and become more diverse with your service delivery, certainly hold events and into the community so they understand who you are, what your mission is, and how your service delivery relates to them in a positive fashion. And certainly this assists patients and their families in the care process and promotes patient-family responsibilities for health, because we all want their buy-in at the end of the day to promote that inclusion. The health benefits of culturally competent service delivery includes improved patient data collection. It increases preventative care by patients. It certainly helps to reduce health disparities in the patient's population. And also it may reduce the number of missed medical visits. And in our occasion, visits that they may have with their service providers for training, for demonstrations, and other types of services that your organization may provide. There are consequences to providing services without culturally competent, considering that it may result in a lack of developing a healthy rapport with the provider and service and consumer. It may lead to a mistrust of the service provider. They don't fully understand and comprehend what you're saying or the service that you're trying to provide. They may not trust what you're trying to accomplish. Therefore, your consumer may become non-compliant with the instruction and the advice that you're providing to them. And unfortunately, it may lead to total disengagement with the program. So if we consider the first steps of becoming a culturally competent agency, I'd like to talk about two case examples which are provided from Advocate Lutheran General Hospital in Chicago, Illinois, and Lutheran Medical Center in Brooklyn, New York. So these organizations have found the need to provide or to increase the provision of culturally competent services in their healthcare system. And we'll start with the example of Advocate Lutheran General Hospital in Chicago. So they are one of the largest hospitals in the Chicago area. This hospital has 645 beds. They're a teaching hospital and a research hospital. And they found to become a culturally competent organization, they focused on, number one, improving its staff's cultural awareness and enhancing the organization's connection to the ethnic communities that the hospital served. So definitely training is at the heart of cultural awareness. So you're going to make sure that your organization's training models, your onboarding processes definitely are conducted through the lens of cultural awareness, and also a focus on the service area and the diversity of the individual that your organization serves. Some of the challenges that they faced included this. They discovered that the staff's lack of knowledge about different cultures, including language barriers, socioeconomic and ethnic barriers, provided a lack of cultural competency to the way that they were doing things in the past. And as a result, they employed this intervention. They developed a robust educational program to train their hospital staff. They also analyzed their local demographic data and patient data to determine the ethnic composition of the individuals being served. And based on that analysis, they focused on definitely robust employee orientation, and they added ongoing training to their process as well. Additionally, they made sure that the leaders of their organization met with new employees to discuss their cultural competence initiatives. This hospital also formed a diversity group made up of staff members who organized cultural awareness days. And those days allowed the hospital staff to interact with individuals from different cultures that are represented in their greater community. And that community educated them about different cultural practices and things that they could be engaged with in serving their population. And of course, the end result of their initiatives really resulted in an increased cultural competence in service for the entire hospital staff. In consideration of the case example of Lutheran Medical Center in Brooklyn, New York, their center is part of Lutheran Healthcare. They have a 468 bed acute care hospital and trauma center. They serve an extremely diverse community in Brooklyn, and they estimate that their patients and staff members speak about 73 languages and celebrate 30 different ethnic holidays. So the goal of their intervention, they embrace the wide variety of cultures in their community. They develop resources necessary in-house to become culturally competent. They even developed an entire department of cultural competence, which allowed them to foster an environment where they had a cultural initiatives coordinator and a vice president of cultural competence. So patient relations with staff included multilingual and multicultural individuals. Their medical center also used community liaisons and cultural advisory committees to reach out to the community. Care delivery forms and hospital signage are translated into the 5 primary languages spoken in their community. The hospital staff and medical residents are required to receive cultural competence training. They even created a Chinese unit within its healthcare system to address specific cultural issues for Chinese patients. And as a result, they are now tracking the impact of their cultural competence programs through bed occupancy and the number of patients from the local community. Many of those patients seen at the hospital are ethnically diverse. And with growth in those groups and religious groups in the area, the hospital is constantly occupied to the capacity. Patient satisfaction scores indicate very high satisfaction with their health care delivery. So in considering those two models that I just detailed, it is very important that these practices are paramount with the training that you provide in your organization. And because cultural competence isn't end an end of the road destination, it's something that currently and continuously evolves into learning more and more about the population that you serve. How can organizations increase their cultural competency? Specifically speaking, sensitivity training is very important to understand um, the challenges and the barriers to the population that your organization serves. Here at the Division for the Visually Impaired, we provide that training to all new staff under simulation or blindfold, and they perform tasks that may give them a greater understanding of some of the issues that their consumers face. Of course, we discuss training, conducting assessments. So you can conduct assessments of your staff members to determine how their cultural knowledge currently impacts their service delivery and what training needs to be implemented in order to increase their knowledge of cultural competence. Always use professional interpreting services. I mentioned that earlier. You want to make sure that your organization recruits and retains a culturally diverse staff. Rely upon community coordination and also consider offering flexible hours of operation, including weekends. Some people work at certain times, and let's take the example of teenagers in school, especially if your organization serves transition students and you're an agency like ours that's open 8 to 4:30. Being flexible in your hours of operation will allow that population to be more responsive in terms of them being engaged in the services. The national standards for culturally and linguistically appropriate services, and we will abbreviate that as CLAS, and healthcare, they provide a blueprint for organizations like ours to help eliminate those healthcare disparities and advance health equity and improve the quality of services. And we're going to talk about their principal standard that they would like to accomplish, and also 3 areas in which they would like to focus on, including governance, leadership in the workforce, communication and language assistance, and engagement, continuous improvement, and accountability. So their principal standard is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So when we consider governance, leadership, and the workforce, advances and sustain organizational governance and leadership that promotes class and health equity. And that can occur through ensuring that your policies, your practices, and your resources serve the community that you provide direct services to. Recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce that are responsive to the population in the service area. And that should include a variety of providers, such as language interpreters, but also sign language interpreters, and those that provide tactile signing for individuals that are deafblind. Educate and train governance, leadership, and the workforce in culturally and linguistically appropriate policies, practices on an ongoing basis. Again, this is not a place where we run a race and we stop right at the end of the race when we're finished. It's something that should be ongoing and regular. Communication and language assistance. So you're going to want to offer language assistance to individuals who have limited English proficiency and other communication needs at no cost to them, and facilitate timely access to all healthcare and services. So in Delaware, we have a population that is Haitian and Creole. In addition, individuals that are Spanish speaking. And we have a huge Asian population that we serve. So you're going to want to ensure that those who may not fully comprehend the services that you're providing to them, that you're going to want to provide that language assistance to them. Inform all individuals of the availability of language assistance services clearly and in their preferred language, verbally and in writing. Ensure that the competence of the individuals providing language assistance, recognizing that the use of untrained individuals and or minors as interpreters should be avoided. And I can't tell you how many times I've experienced that. And it resulted in miscommunication between the service provider and the consumer. And definitely you're going to want to ensure that you're going to provide easy to understand print and multimedia materials and signage in the languages commonly used by the populations in your service area. I'm thinking about when I take my daughter to our local children's hospital, there are signs with, I can't even number the amount of languages that common directions and information is listed in, but clearly they've studied the community and have really taken great effort to ensure that the individuals that frequent that hospital understand information clearly. And last but not least, engagement in the areas of engagement, continuous improvement, and accountability. Establish culturally and linguistically appropriate goals, policies, management accountability, and infuse them throughout the organization's planning and operations. And that starts at the top of the organization, from administration down to service delivery personnel, and down to individuals who may answer the telephone or greet clients when they come into the agency. And you're going to want to conduct ongoing assessments of the organization's class-related activities and integrate those measures into measuring quality assurance, and also use that data to improve activities. Collect and maintain accurate and reliable demographic data to monitor and evaluate the impact of class on health equity and outcomes to inform service delivery. So if you're aware of what data includes the different cultures in your service area, you'll be more equipped to service that population. And definitely partner with the community to design, implement, and evaluate policies, practices, and services to ensure cultural and linguistic appropriateness. Create conflict and grievance resolution processes that are culturally and linguistically appropriate so that you can identify, prevent, and resolve conflicts or complaints. and certainly to all of your stakeholders and your constituents and the general public. You're going to want to communicate the organization's progress and implementation and sustaining those class goals. Data. Data can certainly help you in an effort to ensuring that your services are culturally competent. In your customer satisfaction surveys, include questions in those instruments that's going to help you understand how satisfied your clients are. Do they feel that the staff members understand the importance of their cultural beliefs in their treatment process? Do they feel that you listen to them and their family when they're talking to you and communicating to you? Will the staff provide certain leaders from the community to help them engage in those services or serve as an advocate for them? Questions should include all levels of culturally sensitive and culturally competent questions. You're going to use that outcome data to track trends and identify those disparities, and have your consumers complete a cultural understanding assessment form. And again, use that feedback to improve service delivery. I've listed my sources on this slide, and I certainly hope that you visit these sources to research further the information that they provide in regards to establishing and maintaining cultural competency, and to take these resources and tweak them so that they can be used in your particular environment to address the needs of your community. It has been my distinct pleasure to present to you today, and certainly don't hesitate to contact me if you have any questions or concerns. My information is contained on this slide. And again, I'm the Social Services Administrator at the Independent Living Services at the Delaware Division for the Visually Impaired. My telephone number is 302-293-5218. And my email is Melodye, and that's spelled MELODYE .May, MAY, at Delaware.gov. Thank you for your time today, and have a nice day.